Transforming medical students' understanding of cancer. Assessing an integrative learning design incorporating frame analysis as a pedagogical method. There are no conflicts of interest to declare. In this study, we have addressed the problem of how to grasp the complexity of cancer in medical education. Cancer is a complex issue that represents a central theme in medical education. This involves not only the biomedical and clinical aspects, but also the psychological, the cultural, ethical, economic, and environmental dimensions of the disease. In order to understand cancer as a complex phenomena, students must be able to recognize, critically assess, and integrate these different perspectives in a meaningful manner. Let's start with the theoretical background. According to Behavioural, transformative learning is a transformation of meaning through reflection on underlying premises, leading to meaning perspectives that are more inclusive, differentiated, permeable, and integrated. Or in the somewhat simpler words of Doris Lessing, learning is when you suddenly understand something you've understood all your life in a different way. In order to explain and understand something, thoughts and ideas have to be selected, combined, and organized. This process is commonly described as framing. Cancer, for example, may be described as an enemy of society, a collection of cells, or an environmental problem, dependent on the context and purpose. Frame analysis, on the other hand, is the process of identifying such frames in communication and offers a theoretical, methodological, and critical tool for exploring processes of meaning-making. In this study, we have thus applied frame analysis as a pedagogical tool for medical students to develop and potentially transform their understanding of cancer. About the course. The course went for 2 weeks, where the first focused on information gathering, while the second was devoted to analysis. The design was team-based and experiential and involved collaboration with several external partners, including the Norwegian Cancer Society, the Cancer Registry of Norway, and the Munch Museum. The students were divided into 4 teams of 5. Each team got a research question, which they would answer in a final exam in the form of an oral presentation. The team's research questions were all related to the framing of cancer in society, the framing of cancer death, cancer and sustainability, cancer survivors, and cancer research. After the first day of team building and clarification of goals, the students were introduced to the concept of framing and frame analysis. They were then asked to read a research paper presenting a framing scheme specifically developed to critically analyze cancer-related communication. This scheme comprised 9 specifically defined cancer frames, which were presented in a color-coded handout. Each student was then asked to identify these frames in different newspapers' articles, using corresponding color markers. The results were compared and discussed within the team before key findings and difficulties were addressed in a plenary session. The students thus learned to identify differential framing of cancer-related communication. And they were encouraged to apply this skill throughout the course while seeking answers to their respective research questions. Finally, the teams presented their findings in a plenary session, receiving constructive feedback from their peer students, the external partners, and the faculty. Results. The students' individual frame analysis, combined with the subsequent discussion, clearly demonstrated that they had grasped this scientific concept. There were good correlation between the results of the different students, and the discrepancies facilitated fruitful discussions within and between the teams. They were then able to use frame analysis as a methodological approach in their own research. To assess the deeper learning effects, we administered a pre-test at the start of the course where the students were asked to write their free associations related to cancer. In this baseline assessment, the students predominantly described cancer as scary, deadly, and a pervasive disease often related to medical terms like chemotherapy, radiation, and cell proliferation. The team's oral presentations also reflected a high level of cognition. The students actively used frame analysis as a tool to critically analyze cancer-related communication and engaged in complex discussions with the external partners and the faculty members. At the end of the course, the students were asked to reflect on how the course had influenced their understanding of cancer. They all described a level of change, and one student said it like this: "Before the course, I thought of cancer from a more medical perspective, as a disease that leads to a lot of suffering and death. After the course, I've gained a broader understanding that there are many dimensions to the concept of cancer that go far beyond the medical definition." Another student said it like this: "Cancer involves much more than treatment and late effects, and it will be a challenge for both the healthcare and the welfare system to deal with this in the future." Asked to reflect on how their new perspective may affect them as doctors, one student wrote, "I think I will be more aware of my own communication about serious illness." Another said, "I will try to see illness, patients and relatives in a bigger picture. Be more critical of how information, both scientific and from other sources, is influenced by those who write it." And a third said, "Hopefully I will be brave enough to have difficult conversations about death with patients who need it." In conclusion, the third-year medical students came to this course with a somewhat limited and stereotyped understanding of cancer. They quickly grasped the concept of frame analysis and used it actively in their own research. Their presentations, discussions, and reflections demonstrated a nuanced, critical, and self-reflexive understanding of cancer. Combined, frame analysis in the context of a 2-week experiential elective may facilitate a transformative learning experience about cancer. Thank you.